Hello all, and hello to those joining us via live stream. While we wait to get started, it'll just be about a minute or two here. To access the captioning for today, along the bottom of your screen, if you're in Zoom, you click on captions, you click on captions and it should start showing you the live captions that we have set up for today. A video recording of this meeting will be publicly available on YouTube, and we are live streaming currently. So for folks joining us via Zoom, welcome back. And for your privacy and security, we recommend setting your Zoom name to your first name and last initial. Please introduce yourselves in the chat if you'd like, and rename yourselves with that first name and last initial. Regarding pronouns, please share your pronouns if you'd like to. And feel welcome to share in the chat or with me personally anything important for us to know about working together with you today. Finally, please private chat REALD and SOGI or OHA staff if you are having technical challenges, but for technical challenges in particular, we would recommend that you chat Kim Hill or Sareka Guzman, who are both have REALD and SOGI staff in their name on the participants list. And please check out the Equity and Inclusion Division rulemaking website for more information and resources about the RAC as usual. Okay, we're gonna go ahead and get started for the rest of our content today. Go ahead, Matt.
Good morning, everyone. My name is Matt Friesen. I use he, him pronouns, and I'm the REALD SOGI manager over in the Office of Equity and Multicultural Services, which is connected to the Oregon Human Services side of the aisle. And so it's great to be able to join you today. And I appreciate, in addition to the actual work we'll be doing here, the collaborative effort, because this is a collaboration between OHA and ODHS. And so I want to welcome you on behalf of both of the agencies in this work that we're doing. In terms of introductions, I would encourage you, if you feel comfortable, to take a couple of moments to introduce yourself in the chat this morning. If you could add your name, pronouns if you would like to do that, and your organization and role, gives us an opportunity to get to know each other a little bit more. I'm going to take a moment or two here to walk us through the 3 objectives for this morning, and also to remind you that anything written or included in the chat is also part of public record. So just be aware of that as you're including comments there. So if we want to hop into the next screen. So on this slide, a real quick overview of our agenda this morning. You can see where we're going to be walking through at various stages, and we hope to stay on pretty close track in terms of time today. And as for objectives, we want to hop over to the next slide. 3 main objectives today. So our hope is by the end of this meeting that we will have been able to summarize the main points of agreement on the standards and also identify points for where there's some additional discussion needed. Second, to be able to advise OHA and ODHS on breakout questions and also the draft notice of rulemaking, which we'll explain a little bit more down the road here. And then finally, third, to understand the rulemaking timeline. So the RAC process that we've participated in is part of that timeline, but there's additional steps down the road, and we'll have an opportunity to talk about those as well. I think that's it for my little piece of the adventure here this morning. So I will hand the ball off to Marjorie.
Good morning, everyone. I'm not seeing, oh, here we go. I wasn't seeing the Zoom slide. So let's go ahead and get started and go to the next slide. We realized in the course with the SOGI question, there was a recommendation of having a question of who is filling out this form. But we realized that that question really shouldn't be focused only for SOGI. We should be considering putting that at the top of a template, or the beginning of a data collection format and to be asked regardless of SOGI or REALD, to just be asked who is filling out the form. Is it the person themselves alone, or is there another person present? And that and I think there was a follow-up. There may have been a follow-up question, I think, after that. Who is this other person that's missing on this slide? The other thing that we realized that we needed for all of them is the date of birth, because that's how you calculate time lived with disability later. If they say, yes, I became, for example, in my case, I became deaf at birth. So you know that I've lived X number of years with that disability, which has a big significance in terms of health inequities and life trajectories. So we need to, and also the date of birth helps with triaging. So we added these two questions. Let's go to the next slide. We also added, in the last RAC, we added 23 additional race ethnicity questions. We incorporated a standard using what was already required by Washington State for providers working in Washington State, which includes many of the large provider systems in Oregon as well. So hoping that won't be too much of a burden for the providers in Oregon. We also, but not only Washington State, but also using the 2020 census figures to find a middle ground. We consider the numbers available for the Jewish community, if you go to the next slide, and the Portland area as well, because those figures are not in the census, and how people prefer to self-identify in the case of Afro, Latino, Latinx. That is also not a census category itself. If we go to the next slide, so the last 3 RAC meetings, we had lots of discussions about adding the Jewish groups and then MENA groups. So at the end of the day, what we find is that we added 15 of the 23 categories. 15 were those that had more than 2,000 in Oregon and required by Washington State for their providers. 5 were requested by Jewish and MENA communities and Afro Latinx. So 3 Jewish categories, 2 other MENA categories, and Latino, Latinx, Afro Latinx. Go to your next slide. We also added 3 other unlisted. In actuality, 2 of them, Middle Eastern and North African, we had previously. We'll be changing the name though. Instead of Middle Eastern, it would say other Middle Eastern unlisted. Please specify. Other North African unlisted, please specify. But we will have other unlisted for the Jewish category, so that was part of it. We are proposing that on paper forms that we require adding an open box text field on paper forms where people are encouraged to write in what is that other category to explain more. In online formats, it's going to be easier to, instead of having 6 open text forms for online formats, having 1 online open text where if they checked other unlisted here and here and here, it would have a follow-up that would say, please share more about the other categories the other analytic categories. So that should reduce some of the challenges when translating this into an online format. This is a summary on the next slide. This is a summary. So using a combination of the what's required by Washington State in 2000 plus, we ended up what was specifically requested by MENA communities and Jewish communities, is we ended up with 5 Asian categories, 3 Latinx categories, 3 Jewish categories, 9 MENA categories, and 3 white categories. So it's a way of being more systemic. Let me pause there and look at the chat. So Sally, you had a question about requiring date of birth. It wouldn't, you could ask for how old you are today, but the other issue with date of birth is we need it as a identifier when we do matching later. So making sure that Marjorie McGee with this date of birth is the same Marjorie McGee with the same date of birth over here. So that would be another reason for having date of birth. Nick, your comment is well taken. We'll go back into the chat and yeah, that's not a problem. So forgive my language this morning. Yeah. If you can send me an email, Nick, on the right language. I'm trying to do this and do everything else. It's hard to remember everything. Thank you. So let's go to the next slide. Next thing that we've been working on for the last 3 RAC meetings. We did a short poll also with people to ask with people with disabilities, and overwhelmingly this format of if you identify as someone with a disability or as having a physical, mental, emotional, cognitive, or intellectual condition, please tell us what you would like us to know. Overwhelmingly, people were supportive of that. So we'll go with that language. We are going to, today in the breakout, we will discuss having another disability question. And this was a late realization, understanding that for the interpreter, we asked people, do you need an interpreter? And if so, what type? But we haven't asked, do you need accommodations? And if so, what type? And so we will discuss that in breakout about adding another question, a very short question of, do you need accommodations? If so, what? Now I'm going to turn it over to Cliff. Let me just check and see, make sure. Thank you. I turn it over to Cliff. Thank you.
Yeah, thank you so much. Let's go to the next slide, please. All right, so I'm gonna give you sort of the state of where we're at in terms of agreements for our SOGI questions for adults. I don't think we've had much movement or change on these since the last time we met, so this should be fairly brief, but then we'll transition over to our discussion of SOGI questions for minors, where I think we have a bit more to share. So our current agreements for the SOGI questions for adults begins with this question for gender, the please describe your gender in any way you prefer. So that's our open text question for gender. Next slide, please. And that is followed by our categorical question for gender. So what is your gender? Check all that apply. Things that we have adjusted or added over the course of this RAC includes the categories for gender fluid and gender queer, as well as adjusting the language for the not listed my gender is. So we've made that adjustment to make this more plain language, more accessible. Next slide, please. And that is followed by our transgender question. So are you transgender, with the options of yes, no, questioning, I don't know what this question is asking, or I don't want to answer. Next slide, please. And then we have our first sexual orientation question. Again, we lead with the open text. So please describe your sexual orientation or sexual identity in any way you prefer. Next slide, please. And then we have our categorical sexual orientation question. And changes that we've made here includes, we removed the category of same-sex loving, and we also, again, adjusted the language for the not listed my sexual orientation is category. So we adjusted that to what you currently see here to be more plain language as well. Okay, and then that brings us to SOGI for minors. So that was quick and easy because, like I said, I don't think we changed much since the last time this group met for adults. So I believe for the minors discussion, we turn it over to Marty.
Thanks, Cliff. Yeah, so from the last few RAC meetings, there's been a lot of conversations about confidentiality, privacy, and safety concerns around collecting SOGI from minors. And one of the takeaways there is that it's really important to ensure that there is really clear and comprehensive communication about confidentiality so that minors are aware of what the confidentiality policies are, what the privacy policies are. And so we have updated some of the messaging in the OIRs to providers about what must be communicated prior to collecting data. And notably, this can vary by context. For example, the confidentiality concerns are different in anonymous surveys versus information stored on health records because of who it's tied to and who can access that information. Next slide. So before I get into what we have proposed adding to the OIRs, what is already in the legislation that is for people of all ages is this: prior to data collection, requesters must inform the individual and, if applicable, their caregiver or guardian that data collected under this ORS 413-164 is reported to the authority, how the authority, CCOs, healthcare providers, and health insurers use the data. Next slide. Of the purposes for which the data may not be used, and that the patient, client, or member is not required to answer questions regarding REALD or SOGI. So this is what's already in the legislation. It's not something that we can change, and it's what is for all individuals, not just for minors. Next slide. The proposed messaging that's we have proposed to add to the OIRs is, in addition to the communication required in ORS 413.614 section 3, which is what I just read to y'all, prior to collecting REALD and or SOGI data from an individual under age 18, requesters submitting under that ORS 413-164 must inform the individual of all relevant confidentiality policies and regulations, including who may access the individual's demographic information and whether or not this information may be disclosed to parents or guardians. So last RAC, we had messaging that was specific to medical settings, but there's been some feedback that this is different in different settings. And so we want to then made it broader so that organizations or requesters have to be aware of the confidentiality policies and regulations and communicate that to minors. This is a conversation that should be or is usually happening already with minors when healthcare is happening, because in any healthcare data collection, these confidentiality policies are really important for minors determining what they will or won't share. Next slide. And then there's one proposed question for individuals under age 12, which is, are you currently a boy, a girl, both, something else? It changes over time. And then the three, I don't know what this question is asking, I don't want to answer options. And so they're not asking about sexual orientation for minors under 12, just about gender. Next slide.
All right, now Cliff will get us into the breakout sessions with some instructions first, and then we'll have 35 minutes for the first one.
Yes, excellent. So we have our standard instructions for our breakout groups, which is that we ask that you select a note taker as well as a facilitator, with the expectation that the note taker for your group will be sharing back in the chat box as best they can the notes and takeaways from the session once we return. Other things to know about our breakout groups: please make sure to keep space for the subject matter experts and those with lived experiences in the discussion. Sometimes material may be new and you might find yourself wanting to better understand a particular issue or question. Please feel free to reach out to staff in the chat, and we'll provide more resources and info as best we can. Each group is going to have at least one staff person present to help respond to questions like that. So you should have received via email the breakout session document, which has the questions for each group here. We are going to have two groups today. The first is language and disability, and the second is focusing on sex. I want to share with you all what some of the questions are going to be that will be tackled in those groups so that you can make an informed decision about which group you would like to attend. So some things that will be addressed in the language and disability group. We have new language for one of the questions. So if you, the question is if you need or want an interpreter or other language access services in person, on the phone, or virtually, did you receive them? And then the questions in regard to that we're asking the group to discuss is the question easily understood by people who need language access services? In general, does the updated question and other language questions help to capture the data to identify and address inequities? Also in that group, we'll be addressing disability. So to align with the additional questions about language access services, there's newly proposed additions to disability questions that will be addressed in that group. I'm seeing very quickly. Okay, and then we will move on to our the content for the sex group and what will be addressed in that group. So in that group, we have 3 questions. Obviously, for both of these, there's room for further discussion, but the 3 primary questions in the sex group is in question 4B, should we shorten the default list of options? Should we define intersex in question 3? And is the question, what is your sex, clear? So we have those 3 questions for the group that will be discussing the sex questions. Okay. So those are our primary points of discussion for today. So we encourage folks to pick a group that is most appropriate to your interests and experience. And let me double check our lesson plan to see how much time we have for our breakout group today.
Yeah, we have
Oh, go ahead.
I'm sorry, Cliff, you were just saying you wanted to put it in, but we have 35 minutes and now we are running ahead of schedule. So we're just going to come back at 10.
Perfect. And then there will be a break, and then there will be a second round of breakout sessions. So you will have the opportunity to attend both if you'd like, or you could attend the same discussion twice if you'd like. All right, and I think with that, let's go ahead and open up our groups.
All right, just opened them. Let me know if in the chat if you cannot see that the breakout rooms are open, and you should be able to click the blue button next to language and disability or sex and click join. There's a blue button that says click join. Okay, Leslie, I see your message. You can't see any of it. Would you like to go into either language and disability or sex?
The first one, please.
Absolutely. Let me put you in there myself.
Thank you.
Okay, there you go. Kristen, are you having any trouble joining a room, or would you like me to assign you to one? All right, we've got about 20 seconds where everyone will be returned to the main room. Then we have a 10-minute break. Welcome back, everybody. This time we just want to make sure everyone gets a 10-minute break. So come back at 10:10. I guess it's more of an 8-minute break at this point, but come back in 8 minutes and then feel free to join the other breakout room or the same one. That will start at 10:10. Oh, and one other little announcement I wanted to make was just a reminder that everything that is verbalized or in the chat will be recorded. Or rather, the chat will be part of public record, but anything you say in this room during the break will be recorded for the live stream. So just a reminder to keep that in mind.
One other quick thing in case I missed it. Note takers before going on break or before diving into the next session at least, please put your notes from the first session into the chat boxes before we lose them and dive into round 2. Thanks.
That's a good reminder, yes. Yeah, please pop that into the chat.
If the notes are too long for Zoom to be happy, is it okay to just email to you all?
We would like them to be included in the public record. So if we
Okay,
need to like paste them in chunks, I think that would be preferred.
I will spam it out.
Thank you so much.
Yeah, it can be in a bit of an ugly format for the chat. If you wanted to also email it to us, that would be good too. Better format. All right, I am opening the rooms again, same rooms, but everyone's starting unassigned. So please feel free to join either one. It could be the same, although we encourage you to try out the other room. And for those who don't see any pop-up, if you can look on the bottom of your screen, you might see in the large menu with all the icons to the far right, there's 3 horizontal dots that says more. And if you click there, you might be able to click on breakout rooms if it doesn't automatically pop up for you. But otherwise, please do just speak up here or put in the chat that you are having trouble and I can assign you to whatever room you want. Katie and Antoinette, are you having any trouble joining your room or do you just need a little bit more time? Okay, we're officially in breakout session 2 and we'll be here until 10:45. All right, we've got about 1 minute before everybody returns to the main room here. All right, everybody, welcome back to the main room. We will get started on our debrief. Advance the slide. All right, Cliff will lead us in that.
All right, thanks everyone. I will reiterate one of the things that I've said in previous sessions, which I continue to be impressed and humbled and amazed and content and fulfilled by seeing these conversations, being a part of these conversations where we're again and again seeing folks coming to these conversations and sometimes coming at disagreements, right? But coming at them from a place of being invested in ensuring the well-being of those most impacted by the work that we're doing. So I want to sort of preface all of this debrief with that. That being said, what I would like to do is start with the first breakout session that we had and see if we have anybody from the language and disability group who's willing to say a few words about significant takeaways from that discussion. Anyone available to speak to that? If not, I may challenge our OHA staff, if anybody was in the room and is willing to, well, I know folks were in the room, but any OHA staff that were in the room willing to say a little bit about takeaways from that session.
I don't know if Margie wants to go, but I think we had fresh perspective from the first and second breakouts about some of the questions we had asked, but the first breakout agreed with the change we had proposed in the follow-up question about asking for whether the language access services were provided per their request. And so there was alignment there. However, in the second breakout, there were other concerns about asking people, for example, what language do you use at home? And whether the emphasis on home was concerning, given that either some people have different understanding of what a home is, if they're houseless. And so that brought up a number of conversations around potential changes and what that means system-wide. Not that system is going to hold us from making any change, but we reflected on that. And there were some suggestions that we've taken notes on to consider integrating to ensure that we address the needs of members who may not consider themselves as living in a home. And also, one of the suggestions was to say, what language are you most comfortable using, for example? And so we had very engaged conversation in the second breakout, which informed some of the changes we hopefully would want to integrate for the final review.
Wonderful. Thank you so much for sharing, Kweku. I'm going to give just a moment in case anybody has anything that they want to add to that summary before we move on to the next group. Okay, well then I will turn it to our the sex group from the first breakout session, if we have anybody who's willing to share some takeaways from that first session.
I took notes. I'll be happy to share. We started with a remark about some changes. Remark from OHA staff. The question that was formerly, what was your sex assigned at birth, was changed to, what is your sex? There was a related comment about the importance of this, that relying on a sex at birth type question erases many categories of intersex experience, which are very often only discovered later in life, not at birth. And since the sex question in the SOGI recommended, the draft SOGI questions is the only place where intersex becomes represented. It's the only in the current standards. That's an important one to make sure is not excluding. There was a lot of discussion about question 2, and I guess I will say that we landed in this section in the next session, which I'm sure Seth will speak to. Not to speak for you, Seth, but I suspect you may speak to it. There was a lot of discussion about refining question 2, so it was really explicit why the question's being asked. That is, documentation for matching purposes and sex on documentation for matching purposes, and decentering sex in the categories of response and centering the different categories of documentation. There was, let me see, I'm looking at my notes here. For question 3, I noticed that there was a lot of guidance given about if a federal agency insists on a binary classification of sex. I felt that the language in that note did 2 things. And that was, it only looked at that case. It didn't give guidance about if a federal agency has more than 2 categories, more than binary categories for sex. And it also seemed to imply, in a sense, or connoted that federal must equal binary. And that's not the case. For example, currently passports, which is a federal form of ID, have an X option, and as well as M and an F option. And so can the language on that guidance really reflect conformance with a particular federal agency rather than assumption that federal equals binary? There was also expressed, back to question 2, concern that the guidance given doesn't in any way create a barrier to people actually receiving benefits. And one of the comments was that, for example, folks who work with the one system are extremely savvy to federal reporting requirements and will make sure that those are tracked as needed for accessing services. Anyone else? All right, that's it.
Wonderful. thank you so much. We'll turn now to the second round of breakout groups. Is anyone willing to speak to the second round of the language and disability discussion? Or did we cover everything in our discussion of the first round? Okay. Well, in that case, let's move on to the second round of the sex discussion. Were there additions that came from the second round of the sex discussion that were not covered in our debrief of the first half?
Yes, and then I'll put these in the chat. There was additional discussion about adding Social Security as a category to question number 2, which asked about documentations where there may be difference from collected sex. There was a recommendation to alter the note above question number 2, which asked which documents you may have a difference of sex on, to change the phrasing from a provider or a person collecting may alter this list to be just what you need to collect, so that you're not collecting arbitrary information. For example, if a clinic does not, or an organization does not collect insurance information or bill insurance, they should not add that into the list of things that folks would fill out. We changed that from may to should or encouraged to, so that they're really not collecting other information. The other component for question number 3, which asked about federal reporting, to echo Alexis, I think the suggestion was to remove the specificity of SSN, Social Security, and passports and make it more broad, just that if there is a federal system that is still collecting male and female binary, that this is why we'd want your clarification of which we should select for that bridging with a national system. There was a lot of discussion about whether we should define intersex and whether we should add a second question on its own. So we added into the notes some examples of organizations and ways that one could do that. I think we got to the conclusion that number 1 looks good as it is, and that it is more clear than the first round last month. So folks were going to leave it as it was and not add a second question.
Thank you so much for that information, Seth. Really appreciate it. Any last comments, reflections on any of the breakout group sessions before we move on to the next business? All right. Well, thank you all again tremendously for bringing your integrity and willingness to contribute to these conversations today. I'm going to turn it over to Colleen for the next steps in the RAC process.
Hey everyone, thanks for having me. I think next slide, let's see. I'm Colleen and I am the OHA and ODHS Administrative Rules and Policy Manager. So I get to help with all the rules across OHA and ODHS, of which you can imagine we have many. So I wanted to talk to you very briefly about a couple of things. One is where we are in the current rulemaking process and with the RAC, that is, and where we're kind of going in our next steps. Next slide. This is the board that I lovingly call the Candyland board. So it's happy, hopefully. Where we are in the rulemaking process, if you look at the bright purple colors, those are meetings where we have intentionality for external folks like yourselves at the RAC meeting. And that second purple one called RAC meeting is where we are, what we're kind of wrapping up now. We didn't have temporary rules, so kind of going back a step, we did look at community engagement, who should be on the RAC, who do we need to make sure is part of the table. In the discussions, we determined with tribal affairs at our agency if the changes here were deemed by the tribes to be a critical event to see if they wanted a consultation. We drafted the materials in which then when we came to this meeting, we were able to discuss. So after today, the REALD and SOGI team goes back and thinks about all the edits and the comments. Luckily, we have the video that we recorded, so we can go back because we're human and we don't remember everything. And then after that, that kind of concludes the first engagement phase. And then we kind of turn the arrow on the Candyland board and we file what we call a notice of proposed rulemaking. And that's a document that Secretary of State requires us to file to officially open up rules to be changed. So this is all kind of that pre-process before we've even filed anything publicly. When we file that notice, the yellow box, it says notice is in the SOS Oregon Bulletin. That allows the public comment period to begin. So that's people impacted by the rules, like yourselves listening on the YouTube, those in the RAC, and maybe even people who don't realize they're impacted that might want to make a public comment. You can either do that in writing, email sort of thing, or you can come to the final purple box, which is the public hearing. And that's open to anyone, including RAC members, including those on the call. So you have that time. So don't feel like right now is your last chance to get any thoughts in. You might be mulling over things after this, and you're included in that phase. And then that next yellow box, the public comment period ends. Unfortunately, for us to be able to file and grab everything, we do have to say, for this rulemaking anyway, for these edits, we're going to close the public comment period. And then we're going to gather the comments, kind of just like we do for the RAC. Every meeting we have, we review what happened. We think about what people are telling us. We think about what our statutory requirements are. And then we go down kind of out of that public comment phase and enter kind of the finalizing phase. So kind of taking the next arrow that goes over on that third row, we file the permanent rules, and that's a filing called the official order and certificate for Secretary of State, where it changes the rules. And so then we post that to our websites. We'll notify all of you, RAC members and interested parties, anybody on the REALD and SOGI listservs. And at that point in time, we have a big red circle of end. That means rulemaking is over. The rules are official, they'd be effective, and they'd be in effect and living. That doesn't mean that implementation and changes about like, how do we do this, and questions end there. It kind of starts just a new phase that isn't rulemaking. And then until we decide with either future legislation or other reasons to change the rule, in which case we start the Candyland board again. So that's kind of an overview of the general rulemaking process here in Oregon. And that's not just unique to ODHS or OHA. It's kind of all of us generally go through that same process. So I'm going to just pause in case anyone has questions before I move to my next slide. Anthony, go ahead.
Yeah, thanks, Colleen. Is there a way to become notified about the Secretary of State Oregon Bulletin notification? Is that, like, can you talk a little bit about that?
Yeah, that's a great question. Yeah, you can always go to their website anytime. They publicly post things. And when I'm not talking and can't manage talking and typing, I'll drop a link into the chat. But there's also a way, I believe, for you to sign up through Secretary of State. But when we file anything, we also, if you're already on our listserv, any changes that we filed, we post out. And that goes for any of our 28 rule chapters at OHA or ODHS. But I don't manage a Secretary of State one, just to kind of differentiate that. Hope that helps. Antoinette?
Yeah, hi. So I wanted to add that traditionally, when I've participated in RAC meetings as well, we are also, those RAC members are also sent a courtesy notice that, by the way, we've filed the proposed rules with the state, or here's the final regulation with the state, just for those that are not signed up through the OHA.
Yeah.
So just an idea, if you can give us a courtesy heads up that this is what's transpired since we last met, rules have been proposed, the rules have been adopted.
I completely agree. We should always do that.
Great, thank you.
Yeah, so you know where we are, and you can also understand what we've, what decisions that the agency has made as far as what's about to be noticed. Also, just a side note, when we do notice it, so if you see changes that we make in a RAC and then you see slight changes from what is filed, sometimes that's because our DOJ legal counsel has said, well, make sure you stay within your statutes. And then you might see a slight change again when it's permanent. So sometimes we edit sentences for plain language or clarity. But generally, because these are E&I rules, we're also talking about those kind of things here as well. So hope that answers your question. I don't see any other hands, so I'm going to go next slide. I just wanted to comment. Most of you have been here throughout the whole RAC process, but I just want to acknowledge in that one little square where it said RAC meetings, we've had 4 RAC meetings, and here's our dates: November 17th, December 1st, December 15th, then meeting again today, January 12th. We're going to gather these comments and assess the changes that we might need to make to the rule. And then you'll likely see in March that public comment period opening. Secretary of State publishes their bulletin on the 1st of every month, or as close to the 1st as a working day. And I see March 1st this year is a Friday. So I'm hoping SOS will publish things the 1st, because otherwise the next working day is the 4th, that following Monday. So yeah, look for kind of the next big step in March. And then next slide. Okay, so I'm going to phase into one part of the things that we talk about in RAC, and what we've been talking extensively about is the rule text and the questions as far as the content of these particular rules, right? But what we haven't talked yet about is that notice of rulemaking draft that we have to file with Secretary of State. And part of the thing that the Attorney General's request that we, to make it a RAC, to make it official, and capital letter RAC, is that we have you as RAC members take a look at this notice document, not only look at the text and say, what is your advice? How does it affect you? What can you share? What have you learned? What can we learn together? Same kind of questions go for the notice and the notice of proposed rulemaking. And so things on this are the fiscal impact, which sometimes is great because we might have people that are very financially oriented and have money numbers for their affiliations that they might be representing here. And some might have to forward that on to people in the businesses that you work at, excuse me. And then the other big piece is the racial equity statement, which is new in Oregon as of 2021. It was in session 2021 and went into effect 2022 in January. And so that statement is a statement on how these rules, in particular, the changes that we've been talking about, impact racial equity in the state of Oregon. And so that is the guidance we have there. So we typically draft that and share it with you. The way that we're going to handle that today is we can talk a little bit about it now, but we've already sent out, and we'll send out a reminder to the RAC members to fill out the fiscal impact survey link to get comments back to us. I think it's 2 weeks. Let me look at my calendar. 2 weeks from today, January 26th. So if you could get your comments in about that, if you look at those questions and you say, whoa, I don't know how to answer these. Like, I don't know that I'm the best person. I'm great at the text questions and the content, but I'm not the fiscal person. Please feel free to pass it on to who in your organizations or those that you're here representing as RAC members. Just say, like, I need help. How do we make sure we get OHA to have correct numbers? Yeah, next slide. Oh, I guess before we go to closing, did anybody have any questions about that survey? Sorry.
Well, I was hoping we could also maybe share screen and go through the impact statements.
Did you have that up, or did you want me to throw that up? Because I don't have it right handy. I'm sorry.
Yeah, no worries. I'm sharing the slides, so I could also share the notice, and you could drive, or I'll drive, I guess, drive the sharing, but you could.
Yeah, thank you.
Okay. New share. Let's do Okay, so let
Thank you for
me,
being so quick about that. Okay, so this is the worksheet that we use to fill in the content for the notice of proposed rulemaking, and we'll just kind of go through it here together so we can all talk about it.
maybe I'll zoom in a little bit more.
Yeah, no, I
actually.
appreciate it. I'm just kind of talking while you're doing that. I appreciate
Okay.
you pulling it up. So filing contact for this one is Marjorie, and we have kind of standardized information, email, phone numbers, and addresses of where folks can send comment and know who the filing contact is. Right now, because our estimation for our timetable is, like I said, to be in the March 1st, 2024 bulletin. That would mean that our public comment period goes through March 21st, gives us 3 weeks. End time for those comments to come in is 5 p.m. And then some of these pieces are just, required for the Oregon Bulletin is a filing caption, and it should be the same filing caption on this one and on the permanent filing. So it helps you find it if you're doing any kind of searching on Secretary of State's database. And it adds SOGI and updates the REALD demographic data collection and reporting as authorized by ORS 413-161. It goes down to talk about when our hearing date is going to be, which we have in gray is March 19. I don't want you to lock that into your calendars yet. We haven't solidified that, but that's to be determined. So much of that is not too much of what we need your commentary on and wouldn't be in the survey. So what I wanted to focus on a little bit is a statement of need and fiscal impact. And one of the things that we're required to talk about, and we're is in any agency that files in Oregon, and what we hope to get your advice, RAC members, on is have we written this in a way that meets plain language standards, like is it easy to understand? Can people read it? Does it get the gist across of what we're doing both in this RAC and in the rulemaking? So think of it as if you were reading this for the first time, which some of you will be eventually, would you understand what the changes might need to be and that the changes themselves would match what this statement is? And so I'm not going to read through it here because I didn't want to get too much into like the weeds, but what we can oftentimes do is think about like, did we mention what we're talking about? And so think about that. And then one highlight I see is that we're still waiting confirmation from the tribes about adding tribal questions to the data collection. So we have that highlighted for our own notes to see what our own tribal affairs folks have advised from their conversation with the tribes here in Oregon. Yeah, does anybody have any questions about this statement and what need and fiscal impact is? Need for the rule, and what is that fiscal or economic impact on those that have to follow it?
I wanted to add that, this is a lot to take in right now, but we have the next at least 30 minutes to look and review about this. So you have the link in the chat to review even after this meeting. And so although we encourage you to make comments that you think are important right now, if you are someone who needs time to look at things in process, you could email us and we'll give you that email before the end of this meeting, your thoughts or suggestions for wording too. So I just want to let people know that this isn't your only opportunity to give feedback on this part. That's just my note.
Thank you. Yeah. I know sometimes I'm one of those people that needs to read things and come back to them and not live edit. In many RACs, if you've been to other RACs with OHA or ODHS, sometimes we have less meetings, so it's more of an equal weight between, we might talk for an hour about rule text and an hour on this document. So kind of depending on the nature of the changes. So yeah, to second what Colleen said, like, don't feel pressured that we have to have. But if anybody is just reading this as we're going, Would it be helpful for me to read through it out loud? Throw a thumbs up. Colleen's
No.
going, okay, why don't I do
No.
that? And I'm trying to keep my little new kitty from stepping on the keyboard. It says the catalyst for the update is House Bill 3159 from 2021, or ORS 413.164, which required sexual orientation and gender identity, SOGI, to be added to the existing REALD race, ethnicity, language, and disability rules. However, the standards adopted by OHA under 413161 were in need of updating. LGBTQIA2S+ communities, communities of color, and disabled communities are disproportionately impacted by health and service inequities. Without collection and reporting of REALD and SOGI data, these health and service inequities cannot be adequately identified and addressed. I'm just going to pause. There's a lot to read. Continuing, comprehensive collection of REALD and SOGI data is a critical building block to achieve full health equity and rectify the root causes related to racism, discrimination, and oppression. Note, we are awaiting confirmation from the tribes about adding tribal questions to the data collection. And note, with REALD and SOGI data together, we can, and then here's a list, use information to improve access to medical treatment and community-based services, design culturally responsive and accessible interventions to improve health, and reallocate resources and power needed to effectively address inequities. That's the end of the statement we have now. So that's just talking at a kind of a generalistic level about what is the need for rule, why are we making changes, and what is, you know, the hope that we're gaining here. So does anybody have any edits? Feel free to drop them in the chat if that's easier. And again, remember that you'll get the survey. It already went out and we'll send a little reminder. And then I'm going to scroll down when people might be thinking, because that's, again, the kind of brain I have as well. Documents relied upon. This is a section of the required form where if we do any research or data, and not every rulemaking has as much data and research as perhaps our rules will, but this is where we keep it, and we're required to link to so that people reading beyond the RAC and beyond the folks on the YouTube channel can have access to that when they find this later. So I won't get into too much what those are. And then now here becomes the trickier part, the math part, right? Fiscal and economic impact. And I'll just go ahead and read it because that seems to be a good way to kind of go through it. But this statement is literally where we're going to ask for numbers or percentages as accurately as possible as we might have them. And we put them in here based on what we hear from you as RAC members. So between January 9th and January 26th, so that's today, right? RAC members completed a fiscal impact survey, which represents for blank percentage, and the blanks mean to be yet to be filled in, of RAC members. And then in parens, from unduplicated organizations, meaning that we don't have two people filling out the survey for the same place, so that we can have kind of clear data representation. So next sentence is blank percentage of RAC members from unduplicated organizations anticipated costs, which totaled blank. So that's just a general cost. To comply with these rules, it's going to cost my organization, for example, blank dollars, or my type of organization, blank dollars in a general estimate. Small businesses that completed the survey anticipated the fiscal impact would be blank. So again, dollar amount, $5, $5 trillion, hopefully somewhere in between there, right? Among non-health entities, one community-based organization, CBO, anticipated a cost of blank for training about REALD and SOGI. So now this is getting into more detailed type of cost for training related to REALD and SOGI. Next one is among health systems, the cost range from blank to blank. So that's a good point to share, is that sometimes we have RAC members, but it doesn't mean all of you have the same costs and same budgets and the same plan to do things. And so in our statement that goes out to the general public, we're not going to just say, if two of you said $10, we're not going to just put in $10 if other people said 500,000, right? We're going to say it ranged. The amount we heard, we're going to disclose publicly about that. And we don't really amend these. This is just a reporting mechanism from what you guys share. Continuing, the breakdown of these costs are as follows. So some of the things that we left in here: electronic health record and data systems, an average of, or range if we have a varying amount that you guys report in the survey, for staffing and for training. So again, it could be that you all submit a kind of a generalized range and we could average that because it's really close, or we might hear from you as RAC members that it's wide ranging, $5 to $5 trillion, in which case we would indicate a range, like that it's this great big range that was reported to us. And again, for all of these with fiscal impact, we're not going to edit them because we're just reporting them. Like, it's just our job to be like, this is what we heard from RAC members. So is there any questions, or did I miss any comments? I saw something pop up on my screen, but I was talking.
That was probably my comment
okay.
in the chat. I said the link to the fiscal impact survey where you all can help us estimate these costs for your org was sent via email a few days ago. It was the email that had the materials attached to it. We will resend the link after this RAC meeting today, so you will have it. And we encourage you all to share. You could fill it out yourself if you have a good idea about these things. It is an estimate. If you have someone in your organization or someone you represent that is that might want to help you with these estimates, feel free to share the link with them. And you have until January 26th on Friday, which is about 2 weeks from now, to get that back to us. And same for any other comments on this notice. We won't be moving on with this notice until we get all of the results back from the survey, and by that date, hopefully other feedback from all of you.
Yeah, thank you. Thank you. Okay, well, feel free to scroll down. I'll just keep going on the form here. One more section of money numbers. Statement of cost to comply, or cost of compliance as we call it, and identify any state agencies, units of local government, members of the public likely to be economically affected by this rule. And those statements come from Secretary of State via the legislature, who tell us ask this question at RACs and answer this question when you file rules. So all of what you see kind of in the black of the 1, 2, A, B, and C below, when we scroll down eventually, is a required question. We didn't make these up. So go ahead and scroll up and I'll just kind of like go through. Sorry, Colleen. So what we drafted and what we're welcoming comment on for identify any state agencies, units of local government. And by units of local government, I've been taught that the AG's office, Attorney General's office, means county governments and other entities, anything that's local, city governments, etc. So we wrote, and hoping for your advice, rules affect OHA and the Oregon Department of Human Services, ODHS, which may incur staffing costs for implementation of the rule, technical assistance to businesses, and creation of tools and templates. Additional fiscal impact for OHA and ODHS varies by the type of database and data collection instruments. Below are some estimates for specific data set needs. And so these are the ones that I believe we've heard so far. So 30,000 for 3 surveillance surveys developed with a vendor and done annually. 23,550 to update Oregon Access System. A to be determined amount, it says line, to update the ODHS data systems. 126,000 to update the One IE system. 30,000 to update the REALD templates and into 20 languages, and 75,000 to create and translate SOGI templates into 20 languages. So from your advice, RAC members, are there other units of local government or members of the public based on this question that we've missed, that we have not anticipated? Are there any other thoughts about categories that we might have missed? Thanks. And then 2 is the big one, an important one. And scroll down, Colleen, thank you. Is the effect on small businesses. And Oregon here defines small businesses as any business of any type, as long as it has 50 or fewer employees. So Google is not a small business, right? It has more than 50 employees. This one has a couple of sub-questions based on thinking of that effect on small businesses. So estimate the number and type of small businesses subject to the rule. Types of small businesses can include community-based organizations, small provider offices, and long-term care and congregate living facilities. So the effect on small businesses we've written varies depending on whether the employee licensed providers as specified in ORS 413.164 once the REALD and SOGI registry goes live, which is estimated in 2027. Additional rulemaking will specify the context and small business context in which the providers mentioned in 413.164 will be required to submit REALD and SOGI data to the registry. All small businesses and community-based organizations who are contractors or subcontractors of OHA and or ODHS and collect demographic data on behalf of OHA and or ODHS are subject to the rules. So yeah, any suggestions or edits based on that? Again, continuing with little b of effect on small businesses. Colleen, if you could scroll down, I'll keep reading. Describe the expected reporting, record keeping, and administrative activities and costs required to comply with the rule. So again, what do small businesses have to, what is the impact on them in regards to those 3 topics: reporting, record keeping, and administrative activities. It says providers that are subject to the rule are required to collect and report the REALD and SOGI data, forms and electronic methods provided by OHA. Those data may be stored electronically or via paper forms. Administrative costs could include staff training, time, and staff to input data electronically and monitoring of updates to the forms and or tools. And then C, estimate the cost of professional services, equipment, supplies, labor, and increased administration required to comply with the rules. So again, thinking about small businesses anticipated the fiscal impact would be blank dollars. So that's where we need your help. And then describe how small businesses were involved in the development of these rules. Member from CBOs, health systems, that employees less than 50, businesses that had less than 50 employees were included in the RAC. And so, yeah. So any questions as I kind of before we move on to the next section?
Yeah, this is Katie with the Hospital Association. Under the part B there about providers that are subject to the rule are required to collect and report the REALD and SOGI data. I thought under the rules that we're doing right now for House Bill 2134 that the reporting part is not required yet, and that would be the piece that would come under 3159 rulemaking.
That's correct.
Okay.
This is Marjorie.
Thanks, Marjorie. I thought so, but I'm glad you jumped in.
Okay.
Yeah, thanks, Katie.
And could you repeat that question? I missed that. I didn't get it.
This is Katie. So under Part B there earlier, it states that providers are required to collect and report the REALD and SOGI data. With the rulemaking that's happening right now, which is for updating House Bill 2134 and the REALD and SOGI data requirements. That's only about the collection of the data. The reporting pieces will not happen until the rulemaking for House Bill 3159, which will come later.
Okay, great. That's my understanding too. Perfect. Yeah. Thank you.
Because that'll definitely color how we do some of the fiscal impact for hospitals as well.
Yeah.
Yes.
And one caveat to that, if a provider currently has a contract with OHA or is receiving money and and there's a stipulation that they need to do REALD, that would be the one exception. It's unlikely to, but just know that. So if you have a contract with us to do data collection on our behalf, or a contract where you're getting money from us to do REALD and SOGI data collection, then you would be required to do sooner than when we do the other rulemaking for 3159. Does that make sense?
Yes.
Okay. Sorry to go down the read there.
No, that's great. I think the question that Katie brought up is a good one, that perhaps we need to amend the statement so that makes it clear. Because if we're asking questions here, are people who are not as clear and been following along as well as we have clear on that statement. So Katie, I hope maybe you make a note of that, so when you have suggestions in the survey, we can grab those in, or feel free to write it up in the chat or an email, anything. And I see the iPhone user, but I didn't catch your name, so sorry, I didn't. I know it was more than
It's
just Katie.
Antoinette.
Oh, okay, Antoinette. Sorry, thank you.
That's okay.
I appreciate it. I appreciate it. Okay, so we good there? Does anybody have any thoughts before I move on to racial equity statement? Okay, just pausing. I tend to talk too fast, so I want to give people a chance. This statement is a new one that started on the form in 2022. And the idea is that the agency looks at the rules, or OHA, all agencies, but we're OHA today, that we're going to look at the rules that are being changed, not the holistic REALD and SOGI program or rules that we're not amending. So thinking in regards to this rulemaking, what is the impact, whether it's positive, negative, neutral, and what are those changes? Do we have the ability to identify what groups are adversely impacted, and do we have the ability to change them? And or did we change them in our discovery, finding out that they have adverse impact? So the statement that we've written, that we also welcome you to amend or think on and offer suggestions later, is REALD race and ethnicity data collection standards increase the availability of granular race and ethnicity data statewide, which helps OHA and communities identify, measure, and begin to address health inequities within and between racial and ethnic groups. Granular data also increases the visibility of previously underserved communities. It also visualizes the diversity of the people of Oregon and allows individuals to see themselves in the data relating to programs and issues that affect them. This rulemaking will increase the number of racial and ethnic categories from 39 to 60. So this is the end of the statement. Does anyone, why we're here, have any thoughts or questions or suggested edits? Okay, I know it's been a long morning, so we're throwing at you text and questions and thoughtful things, and then a big document with money numbers and a racial equity statement, among other things. So feel free to mull these over, fill out the survey. Feel free to think about all things and get your comments in by January 26th. But just so we're all on the same page, I just want to scroll down and show you the rest of the form, because this is the standardized form that OHA uses for our filings to go into Secretary of State. The next question, hopefully is an obvious one, was an rule advisory committee, a RAC, consulted? If not, why not? And we did use one. We're here today. If we were to not have one, and this would still be the form that we utilize and fill out and goes to Secretary of State, or the content would, we would indicate why we did not go through a traditional RAC. Just so you know, in some cases, we don't do that when the changes don't allow for wiggle room. Like say it's a federal change and we're not allowed to move a comma or a period or a single word. We tend not to do a RAC in those cases because we want to honor everyone's time to not bring us together as a RAC to say, what are your ideas about changing the text? Oh yeah, we can't make any of those changes because of federal requirements. Another reason that we're moving to is sometimes a RAC meeting is not the most positive way for us to get advice and assistance and come together to collaborate on the rule changes and programmatic changes. And so you might see from time to time OHA hosting what we call community engagement, which is a really broad term for any number of different kind of meeting types. And sometimes we get invited to spaces so that we can share the rule text in other ways and the rule changes that isn't the space that we host and select. It might be someone else inviting us to talk about it. So you'd see us say that in the if not, why not category. And then the rest of the document doesn't have it here because we're still working on it, would be the rule text and a summary. And so I'm just going to quickly explain these things so that we just can be on the same page. I like sharing information. Rulemaking action is a Secretary of State term for you have a rule, what are you doing to it? And the actions that we can take is adopt, which is adopting a completely new rule. Amend, which means changing an existing rule. Suspend, which means taking a rule temporarily off the books. And then repeal means permanently taking it off the books. That means it's not the law anymore. And then there's one last one called renumber, and it means taking a whole rule number and not changing anything, but moving it to a different location. So it's got a new rule number on the top of it, and nothing else changes. So those are our rulemaking actions. Our rule number is a 3-3-4 number, like 950, 050, 0010, something like that, or 950, 030, 0020. A rule title is a concise name of what you're about to see in the rule language. What we call rule, so where it says full rule text in track changes means all the rules, the rule language or rule text, or the words that make up the rule. And when we say track changes, that's so that we can have any changes that are new to this rule or this version underlined. If it's brand new and what's called a strike through or crossed out, is if we're removing it. So that would be track changes. And then the statutes or other authority, you often see something called an ORS on that line. It can be other authority though, from federal regulations like United States Code, or it could be the Oregon Constitution, or you might even see another OAR as authority, but something granted them, like the legislature or the feds granted that authority to say, you have the authority to say be OHA, to have rulemaking authority, to be equity and inclusion division, and for you guys to have rules. And then statutes or other implemented, really similar rules or statutes, constitution or federal regulations could be listed there. The difference between these two categories is that one is saying, what is your authority kind of to exist as a programmer, to be here, or to have these rules? And what are you actually implementing in this particular rule? So you often see less of them listed in that line. And then the last one is a brief summary of the rule changes. And we're going to clarify brief. It shouldn't be longer than the rule or take a really long time to explain what the changes is. It should be plain language so that as many people as possible can understand it. And it's of the summary of the rule changes. So kind of noting back above that track changes, we want to talk about like, what did you change? Not so much why, but like, what am I looking for in this rule? What's going to ping my interest so that I want to read that rule, especially if it's very long. And it wouldn't be a summary of the whole rule, right? Just unless it's being adopted for the first time, in which case then you might. And I think that's all we got. That whole thing makes up the notice of proposed rulemaking. Does anybody have any questions about this document? Or the survey? Okay. Well, Colleen, I really appreciate you sharing screen and grabbing that up for everyone and letting me read through. And thanks for everyone for having me.
Yeah, thank you for for explaining a lot in that worksheet. That was really helpful. So I don't see any questions, so I will continue on for what we have today. Or Antoinette, I see you're not muted. Is that intentional? Okay, just making sure. So I will reshare my screens for the slides. One moment. Okay, so just one final reminder. We'll go back. Actually, let me advance the slides first. So now we'll just get started with our closing. This is one final reminder about the fiscal impact survey. You will receive an email after this with the link again. And we would love to get some feedback from you on those fiscal estimates by January 26th. This is our last RAC meeting. The next step, as Colleen and explained earlier, will be the public comment period, likely in March. And we will let you know. I thought that was a great point. We'll send you all courtesy communications to let you know about these steps as they're occurring. And please email us with any remaining questions, concerns, or feedback on the notice we reviewed today at this email address, and we'll get back to you promptly. Okay, I'm going to turn it over to Cliff to close us out for today, and as usual with some of those eval questions.
Thanks, folks. Again, thank you all for your participation through this entire process. It's been wonderful, and I think the standards that we've produced here have been drastically improved through everyone's participation and contributions. So we couldn't have done it without you. Do want to invite you all as the sort of closeout to today to help us reflect a little bit on this overall process so that we can improve it in the future. We know this certainly won't be the last RAC that we are conducting or participating in. So if you could share with us either in the chat or through email some of your thoughts on what went well today, what could be improved, and not just today. Think about the overall process, right? What went well, what could be improved in the future. And once again, thank you all so much. And I think that is our closing.
All right, what a journey. Thank you everybody for joining us. I hope that this isn't the end, that we'll continue to have a dialogue with all of you outside of the RAC process. Please stay on the line and enter in the chat some of these feedback questions. It would help us a lot, especially for the future. Otherwise, we'll talk to you soon, and thank you very much.
Thank you, everyone.